Okay. Antiphospholipid syndrome is a systemic autoimmune disorder characterized by clinical symptoms of venous or arterial thrombosis, obstetric complication in women, and the presence of persistent antiphospholipid antibodies known as lupus anticoagulant, anticardiolipin antibody, and anti-beta-2 glycoprotein in the patient plasma. Despite the etiology of antiphospholipid syndrome is poorly understood, it's very important to describe laboratory and clinical features in order to develop classification criteria for research purposes. The antiphospholipid syndrome classification for research purposes is based on the Sapporo criteria, first published in 1999 and revised in 2006. The revised Sapporo criteria, known as Sydney criteria, require at least one clinical and one laboratory criterion to classify as antiphospholipid syndrome. Lack of strict definition and limitation of Sapporo criteria initiated a multidisciplinary effort from American College on Rheumatology and European Alliance of Association for Rheumatology to develop new antiphospholipid syndrome classification criteria with high specificity and sensitivity. New criteria differ from the Sapporo criteria in several aspects. The entry criteria was first introduced that had to be fulfilled for the patient New classification criteria differ from the Sapporo criteria in several aspects. The entry criteria was first introduced and had to be fulfilled for the patient to be classified as antiphospholipid syndrome. Clinical symptoms and laboratory criteria are hierarchically clustered in domains, and each of them is weighted with score points. A patient is classified as an antiphospholipid syndrome if he meets the entry criteria and accumulates at least 3 points from clinical domain and 3 points from laboratory domain. Antiphospholipid syndrome may be seen in healthy individuals, and in this case is named primary antiphospholipid syndrome, or in patients with other autoimmune diseases such as systemic lupus erythematosus, known as secondary antiphospholipid syndrome. Catastrophic antiphospholipid syndrome is a rare and life-threatening condition characterized by thrombosis with the development of multiple organ failure. Obstetric antiphospholipid syndrome is an autoimmune disorder associated with various pathological pregnancies, such as recurrent miscarriage, stillbirth, severe preeclampsia, and severe placental insufficiency. The persistence of antiphospholipid antibodies is the most important laboratory characteristic of obstetric antiphospholipid syndrome. Sydney standard for obstetric antiphospholipid syndrome classification includes clinical criteria, one or more unexplained deaths of a morphologically normal fetus at or beyond the 10th week of gestation with normal fetal morphology documented by ultrasound or by direct examination of the fetus. One or more premature births of a morphologically normal neonate before the 34th week of gestation because of eclampsia or severe preeclampsia, and recognized features of placental insufficiency. 3 or more unexplained consecutive spontaneous abortions before the 10th week of gestation with maternal anatomic or hormonal abnormalities and paternal and maternal chromosomal causes excluded. Laboratory criteria.
Sorry, Ina, but we cannot see your screen. I guess it's at the same place.
Yes, now?
Yes, now we can see.
Okay. Laboratory criteria. Lupus anticoagulant present in plasma on 2 or more occasions at least 12 weeks apart. Anticardiolipin IgG or IgM in serum or plasma present in medium or high titer on 2 or more occasions at least 12 weeks apart, measured by a standardized ELISA. Anti-beta-2 glycoprotein IgG or IgM in serum or plasma in high titer, present on 2 or more occasions at least 12 weeks apart, measured by a standardized ELISA. Obstetric antiphospholipid syndrome requires the combination of at least one clinical and one laboratory criterion. Obstetric antiphospholipid syndrome is an autoimmune disorder characterized by pregnancy morbidity associated with persistent antiphospholipid antibody positivity. Cases fulfilling the Sydney criteria for obstetric morbidity with no previous thrombosis are known as obstetric antiphospholipid syndrome. Cases with incomplete clinical or laboratory data are classified as obstetric morbidity and non-criteria obstetric antiphospholipid syndrome. Many patients fail to completely meet the clinical Sydney criteria. Their cases are classified as antiphospholipid-related obstetric morbidity, and there are women with a history of repeated poor obstetric outcomes who do not fulfill the Sydney criteria for obstetric morbidity, but meet the laboratory criteria for obstetric antiphospholipid syndrome. Obstetric morbidity with antiphospholipid antibodies related clinical criteria includes 2 consecutive unexplained miscarriage of well-formed embryos, 3 or more non-consecutive miscarriage of well-formed embryos, preeclampsia or eclampsia after 34th week of gestation, placental abruption, late premature birth, premature rupture membranes, unexplained recurrent implantation failure in IVF fertilization. According laboratory criteria, fulfill the laboratory criteria for obstetric antiphospholipid syndrome that include the detection of lupus anticoagulant, IgG or IgM anticardiolipin antibodies, or anti-2 beta-2 glycoprotein, IgG or IgM, in medium or high titers. We also can mention cases that fulfill clinical criteria but fail to reach the laboratory values for obstetric antiphospholipid syndrome with low titers of antiphospholipid antibodies or with only one positive test that are not in agreement of Sydney recommendations and are classified as non-criteria obstetric antiphospholipid syndrome. About clinical criteria, fulfill the clinical criteria described for obstetric antiphospholipid syndrome, and according laboratory criteria for cases non-obstetric antiphospholipid syndrome, we can see positivity for lupus anticoagulant, anticardiolipin, or anti-beta-2 glycoprotein positivity only detected once. Low positivity titer of IgG or IgM, anticardiolipin, or anti-beta-2 glycoprotein. Persistent positivity for non-criteria antiphospholipid antibodies, including an IgI isotypes for anticardiolipin and anti-beta-2 glycoprotein. Resistance to anticoagulant activity and thrombocytopenia. According new classification criteria, new antiphospholipid syndrome classification criteria are first published in 2023 according a standardized methodology organized by the American College of Rheumatology and the European Alliance of Association for Rheumatology. They differ from revised Sapporo in several aspects. The entry criteria, the maximum interval between the occurrence of the clinical symptom and detection of antiphospholipid antibody was reduced from 5 to 3 years. The clinical and laboratory criteria are differently weighted and organized in hierarchical domains. The goal of this new classification is to classify patients having antiphospholipid syndrome with high specificity and sensitivity. Our domain in study is obstetric domain, and clinical criteria includes 3 or more consecutive prefetal before 10 weeks and or early fetal death between 10 and 60 weeks, or 1 or more fetal death between 60th or 34 weeks alone. Fetal death in the absence of the preeclampsia with severe feature or placental insufficiency with severe features, and both of them are weighted with 1 point. Preeclampsia with severe features or placental insufficiency with severe features before 34 weeks, with or without fetal death, is weighted with 3 points, and preeclampsia with severe features and placental insufficiency with severe features before 34 weeks, with or without fetal death, pointed with 4 points. According laboratory domain, Positivity for anticoagulant, lupus anticoagulant test. Positive one single time is weighted with 1 point, and for a positive persistent positivity is weighted with 5 points. Moderate or high positive IgM alone, anticardiolipin or anti-beta-2 glycoprotein weighted with 1 point. Moderate positive IgG, anticardiolipin and or beta-2 glycoprotein weighted with 4 points. High positive IgG, anticardiolipin or anti-beta-2 glycoprotein weighted with 5 points, and high positive IgG, anticardiolipin and anti-beta-2 glycoprotein weighted with 7 points. Classify as obstetric antiphospholipid syndrome for research purposes if there are at least 3 points from clinical domain and at least 3 points from laboratory domain. In this short presentation, we want to realize a comparison of two classification criteria standards for obstetric antiphospholipid syndrome. Firstly, it's important to mention that these criteria represent only standard research classification and that are not a diagnostic tool for antiphospholipid syndrome. According standard, to be classified as an obstetric antiphospholipid syndrome, it is required to fulfill one clinical and one laboratory criteria. New classification criteria, as well as Sydney standard, use the positive test for lupus anticoagulant, anticardiolipin, or anti-beta-2 glycoprotein at an interval of more than 12 weeks. In new classification criteria, in contrary of Sydney classification requirements, lupus anticoagulase, anticardiolipin IgG, anti-beta-2 glycoprotein IgG have a higher proportion and meet the requirements for antiphospholipid syndrome, while anticardiolipin IgM and anti-beta-2 glycoprotein IgM positivity alone do not meet the laboratory standard for antiphospholipid syndrome. Considering the evaluation of the points in the new criteria, more emphasis is placed on eclampsia, preeclampsia, and placental insufficiency, and the recurrent miscarriage could not be classified as obstetric antiphospholipid syndrome. According to several studies, antiphospholipid antibody can directly act on trophoblast or decidual tissues, causing fetal loss. Furthermore, epidemiological studies suggest that recurrent miscarriage is the most common manifestation of obstetric antiphospholipid syndrome. Excluding recurrent miscarriage from clinical criteria may lead in inadequate diagnosis and treatment. With new classification with new criteria, classification as obstetric morbidity related with antiphospholipid antibody and non-criteria obstetric antiphospholipid antibody could no longer be applicable, and there is no proposed method yet. And this is a very important topic that must be reviewed by experts. Thank you for your attention.